Hello, my name is Karm and I am the host for Dentipedia. This is a podcast where we decode dentistry with one person at a time. Today we have my very best friend from work and my brother. He is in the industry over 10 years as a registered dental hygienist, and we are going to pick at his brain today. We'll experience the journeys that he has faced and the things that he has learned during his time serving as a dental professional. The guest is none other than Chetas Patel, who is a registered dental hygienist in Alberta for over 10 years. The thing about Dentipedia is, like, I was talking to Linda at Japanese Village. She's like, "What's your thought, or like what's your goal behind it?" I'm like, if you see the dental industry, it's very small to begin with.
Yes, it is.
Right? And
especially in Edmonton.
Absolutely. Yeah. Like, everybody knows everybody. Yeah. And even if you don't know, you will know a person who knows a person.
Yes.
Right?
Yes.
And so I'm like, everybody knows everybody, but still there is a space or a gap where nobody knows how to reach from point A to point B.
Yeah.
And like, people, or say, for an example, dentists wants to be cosmetic dentist or known for cosmetic dentist.
Yes.
But they don't know how to reach there.
Yes.
Right. Same thing, like people, like fresh graduates, they want to get into surgery, but surgery as is, it's complicated. They don't want to take that effort.
Yes.
Right.
Yes.
So they are like, we don't know how to do or what path to take.
Yes.
Right. So it's like all you can see point A, you can see point B, or like initial and where they want to go, or like their dream point.
Yes.
But they don't know how or what route.
Yeah.
And what struck to me is, like, everybody started as noob at a time. Everybody was new, fresh, recent graduate, right out of the college. Nobody is specialist right out of the gate, right?
Yeah.
And then like, if we can somehow provide somebody's journey that can inspire other fresh people who are just getting into the industry, why not?
Yeah.
Right.
That's true.
And
that is true.
I'm like, I consider myself as an extrovert, so I like talking to people. I'm like, why not utilize the power you have, the knowledge you have as a part-time business owner, with knowledge we have as a full-time professional into dental industry.
Yes.
And why not mix together and then bring something that can help anybody and everybody.
Yes.
If needed.
Yeah.
Right.
Yeah.
So that was the goal behind Dentipedia, and that is why we started. So thank you for being the first guest. Thank you for being my guinea pig.
Thank you for having me, actually.
I wanted to start with somebody who I have known for a while. So, yes. Say if I mess up something, then I don't end up with that inferiority complex. That, okay, I invited this person on my show, for an example, and then I messed up.
Yeah.
So it's like better to start with someone who you are already comfortable with, and then start the journey that way.
Yes.
So that it's a lot more encouraging to continue. Because it can be overwhelming at a time. You know, it's like, I wanted to do it for a while, but I wasn't getting out of the comfort zone. I wasn't turning the camera towards me.
Yeah.
Right? Yeah. Like always.
Because you so used to
filming others.
Yes.
Right. So it's like I never turned the camera. But now I'm like, okay, now it's the time. We'll see.
No, that's good. That's good. We started this, and I like the thought behind it, that it's not you're not doing it for a gain. You're doing it for a community, right? Like dental as a community.
100%.
Like you said, no people. It's a small community, but everybody has goals.
Yeah.
They want to achieve something, but they don't know how to get there.
Exactly. It's like the path. Nobody knows the path.
Yeah.
And then most of the times people usually take trial and error method.
Yes.
And then it takes way longer than you need.
Yes. Yes.
Dentistry now, it's at a very, very, very comfortable spot.
Yes.
Where you can take CE courses. You can take hands-on courses.
Yeah.
That will provide you skill set you need.
Yeah.
But then still, to survive in your own community, you need to have at least some background of your demographics, of your patients, of your say economics, of how the town or the city or your practice provides services to those patients.
Yes. Yes.
Right. So,
and to know the people's mindset as well,
100%.
like what they're looking for. Because it's not what you want to provide.
Yeah.
It's what they want.
Exactly. It's like what their need is.
Yes.
And to what level the inspiration or the encouragement is to achieve some treatment.
Yes.
And so I'm like, okay, well, if I take myself when I graduated back in 2019, I was kind of iffy because I graduated in 2019. I moved to high level, right? Very small town, 2,200 people. Now it's expanded. It's like 5,000.
Yeah.
But when I moved, it was very small town. I was like completely cold covered, as we said.
Yeah.
And I worked in an office that was completely traditional office. Pen, paper, no digital technology other than pen. Nothing else was digital.
Wings and PAs are films.
Absolutely, old school films. And I graduated from college that was completely digital. So
and we were the first batch because university there was an old pharmacy and dent building.
Right.
So we were the first batch from going to dent building to K
clinics. Yes.
So we never touched films. We started sensors. So if somebody tells me, because I did rotation at La Crete,
right,
and they had films that time, so I'm like, well, let's get the RDA to take the X-rays because I don't know how to do it.
I remember 16th of August was my first day. 16th August 2019 in Blue Sky,
right,
like Dr. Hammond's clinic.
Yes,
I started at. Like I reached the clinic at 7:40. I'm like, okay, perfect, fresh start, first day at the job. I want to learn everything. First patient 8 a.m. emergency exam. Patient was in pain.
Right.
I didn't know that they were analog, so I'm like, okay. I was looking for sensor. I'm like, I don't see it anywhere. I was looking for a computer. No computers. Other than the front computers, we had just one computer at the back.
Right.
And that was also for a charting purposes if anybody needed. I'm like, okay. So I go to the dentist. I asked him, I'm like, where do I find sensor? How do I take x-rays? He's like, you open the drawer, there's films in it. And you take x-rays on films. And I'm like, okay, films, I have no idea.
Yeah.
And then I'm very glad that he himself showed me how to take x-rays. Right. The first day it was blur. I messed up so many x-rays, especially when developing. You have to go into a dark room and develop an x-ray.
Yeah.
Where first, like somebody like me who doesn't know the clinic at all.
Yeah.
I'm just thrown into the clinic hoping that I would figure out myself. The first x-ray, Dr. Hammond, he walked me through each and every process of how to take an x-ray, how to develop it. But in order to develop, we have to go into the dark room.
Yeah.
And he showed me before we actually went into the dark room. But still, it's a different feeling when you are visualizing compared to when you have to actually do it.
Yes.
Right. And so I got tossed into that. I remember my first FMS 7 x-rays. 2 of them turned out okay. Rest 5, all whitewashed. No x-rays. It was just film that was completely overexposed. I'm like, but second day, I told Dr. Hammond, I'm like, I wanna take a lot of x-rays before I actually take on patients.
Right.
And he's like, sure, you can take either on me. You can ask anybody from the clinic if they are okay to let you take x-rays on them. So I went to the hygienist there, and she's like, yeah, I'm due for x-rays anyway. So if you could take on me, that'd work out for both of us.
Yes.
And then that's how I figured out how to take x-rays on film.
Yeah.
But now when I look back to that time, I'm glad that I had to face that circumstances.
Yeah.
Because then now doesn't matter where I go. I am trained digitally as well as traditionally.
Yes.
So pen and paper charting, I can do that. That's how I remember codes. A lot of times, assistants struggle with codes because you don't remember.
Yeah.
You don't have to remember
That's true.
anymore. You
That's true.
You just select.
And a lot of people at the clinic come to you, right? Like, oh, Karma, what's the code?
100%. And so I take it as a very, very crucial experience right after graduation because that built me the way that I am right now.
Right.
And I took from that base and built on that foundation. And so that is very, very helpful for that. I wanted to ask, how was your first days right after graduation?
Oh, first day. I think it wasn't as tough because what trained us was high level Lakrit.
Yes.
Because I'm really proud and I'm really blessed that I'm a graduate from U of A, because not other universities or other colleges or other hygiene schools have privilege for the student. They have privilege to go to any like satellite programs or like any rotation and stuff.
Right.
So I'm lucky that we did high level and Lakrit for rotations. So when you work in a rural community, you learn more than what you learned in school.
Absolutely.
So getting into the business, it wasn't as tough compared to other colleagues that who got in same time as me.
Right.
But it's always a learning curve.
100%.
Because beginning, I think everybody's nervous when you start, right? So school, you get 2.5 or 3 hours per patient.
Yeah, and we are thrown like 50% less the time that you're used to.
And then beginning that time, now the industry has evolved over time. The industry has changed.
Right.
But that time, it was 1 hour booking.
Right.
You get an hour for scale polish fluoride.
Right, and same 3 units.
And scale polish and fluoride.
Yeah.
And you also sometimes if RDAs are running late or the dentist is running late, you got to take X-rays as well.
Right.
Right. So, but it has evolved over time that now they realize that's no longer blueprint anymore.
Right.
You cannot treat everybody the same way.
Absolutely.
It has to be, the time has to change.
Customized treatment.
Yeah. So beginning was rough, but I feel like I'm blessed that I had that experience for rural community.
Right.
So getting into the business was easy, but the time limit was a shock.
Right.
And also, you barely see, like maybe you have to finish your requirements, so you barely see like 10, 15 patient, whatever.
Right, before graduating,
right?
Yeah.
So, and then you're thrown into like 8-hour schedule.
A full pace office.
Yes. And then you review medical history, you review dental history.
40 minutes already gone.
Yeah, and it's already gone. and then I'm like, so beginning about a week or a week and a half or so was really rough.
Right.
I was really tense. And even my handshake.
Yeah.
Even plus with LA, if somebody's nervous, they're like, oh, you haven't had a cleaning, you haven't had a dental hygiene for about 3.5-4 years or 5 years, whatever. You walk in, and you got a lot of sub-G tartar buildup.
Right.
And I think it's gonna be rough. So they're like, oh, then I would prefer freezing. And I'm like, I do have license, but
I'm not used to it.
But I'm not used to it, So when you go in with the first syringe, I still remember first syringe when Jerry Thomas was an owner of Agape that time.
Right.
And I'm like, where do we get the syringes? And then they grab me syringes, they got me needles, get me carpules and stuff.
Right.
And I go in and then I'm legit shaking. As I go in I believe I'm doing quad 3 IAN. And then I go in and I legit shake, like I legit go in like this. So I think it's the time limit that's overwhelming.
Right.
And but once you get used to of it, then I think then you know how to get along with it.
Absolutely. I remember my very first impression, because back in school you have to take a total of close to 60 impressions.
Yes.
Right.
Yes.
And out of that you have to provide about 12 to 15 models, like presentable models for patient education.
Yes.
Right. One thing we all struggled is we had to try on each other. right, as a classmates.
Yes.
And everybody knew nobody knows anything about impression. We're like all we were like showed on one of our classmates how to take impressions.
Yeah.
And then we were just said, okay, now you take on each other. The first time I overfilled the tray and I went in, and I remember my classmate who I was taking impression for, she almost choked on the impression material, on the alginate, because I had it so overfilled that it just slurped down her throat.
Yes.
So that was a situation where it took us like good 3 to 4 tries to get at least the alginate amount right. We were said you gotta do 3 cups to 30 ml of water.
Right.
But we don't know how much to put in individual arch tray.
Yes.
Right. So like, okay, this much for top, this much for bottom, but how much to fill the tray? And so that like first impression was the worst of my life.
Yes.
And as we took more, that's where the experience also comes in, right? The more you do, the more better you get.
Yes.
But now when we compare, I just took impression after 1.5 years on Thursday for Dr. Lan, right? Denture repair. No alternative of denture repair. You have to take alginate.
Alginate impression, yes.
And I was just talking to Dr. Lan. I'm like, I have no idea how it's going to turn out now. Because last time I took was literally the beginning of 2024. And then I never took any alginates ever since the scanners came in.
Yeah.
And so it's like initial part where you were still figuring out. It was not good for you, not good for the person you were doing the treatment on. Because like both of you know, right? Like it's your first time. You both are shaken. Right? I was talking to another hygienist. Like how did you do LAs in school? She's like, by luck.
And plus we have to practice in each other.
Exactly.
You know? Every Friday there was a class that we scheduled.
Yeah.
Every single Friday you'll go home numb. You know, either lip is numb or nose is numb, eye is numb, you know.
Right.
And we had a bunch of hematomas that time too.
Absolutely.
You know, because if you puncture an artery or if you go in a wrong direction, right? So you do get a bruise, and then it's okay. It doesn't last as long, maybe a week, 10 days, whatever.
That's a benefit of oral cavity though. Like the healing is so fast.
Yes.
Right? But you still have to struggle through that phase when it comes to you.
You do.
But yeah, it would have been nerve-wracking, especially when you know that you are getting needle plus anesthetic. And then you also know the person who is administering it, they have no idea this is the first time coming in.
First time coming in, yeah.
Right?
Yeah.
I'm like, I'm glad I don't have to do that. I'm like, the worst I can do is like put alginate impression, and then it just feels like it's they are basically aspirating it.
Yeah.
But I'm like, okay, that's my far extent that I have gone.
Yes.
But when I see dentists, when I see hygienists administering anesthetic, I'm like, the first I just imagine.
Yes.
I'm glad I don't want to do that again.
Yes.
I don't wish anybody had to go through it. But in order to learn, everybody has to go through it.
They have to, yeah.
Right.
Yeah. Practice makes it. It's the more you practice, it makes it better.
Absolutely.
Because in beginning, even I was scared. A lot of my colleagues has given up their ILA licenses. Yeah, they don't do it anymore because nerve damage is a reality. Right. So you have to know anatomy, you know, and even though you know the anatomy, after all, it's luck.
100%.
Right. So even you do everything right. But it's up to the patient how they take it. You know, or even you don't know if you punctured an artery or tissue damage or muscle damage. You never know until you get the response from the patient.
Yeah. That's the thing about anesthetic. Like all you can visualize.
Yeah.
Is your injection site.
That is true.
But what is underneath that tissue?
Yes.
We have no idea.
And everybody's different, Karma.
Yeah.
Their facial features are different. Their anatomy is different. Some people have thicker masseter muscles. You know, some people have the jawbone is really deep.
Right.
So everybody's different. You cannot. It's not a clear-cut answer that I've got the carotid notch. I'm gonna press it and I'm gonna go right there. Yeah. It's even if you go right there, different people have different anatomy.
Right.
So it is challenging. They make it look so easy in school.
Yeah.
But because we are like perfect patients, like everybody has perfect teeth, everybody who's gone through hygiene school, everybody has braces, nice teeth,
yeah.
Nice teeth, not even much tartar buildup, like many slightly granular tartar buildup. And then you come into a real practice and you're thrown into this hodgepodge of people,
Like complete perio grades,
yes,
and everything.
Everything combined.
Yeah.
And then they expect you to finish it in an hour.
100%.
And that's the pressure. That's when you ask me, like, how was your, as getting into dental industry, how was your first experience? It's thrown into that hodgepodge, then you have to figure out your own path working. you have to figure out by your own experience, how it's going to work out.
Yeah. One more thing that I wanted to add, that I'm glad that I worked in high level for 2 years before moving to Edmonton.
Yes.
Because the cases we saw there, you can't imagine.
No. Yeah.
Right.
Yeah.
The town high level itself is surrounded by 7 reserves.
Yes.
Right.
Yes.
And not everybody there, they are encouraged for oral health.
Yes.
So it's all as needed or as emergency basis treatment.
And Karma, we're lucky that we're sitting on a 3D land.
100%.
This is not even our land.
Yeah. we just got an opportunity to come here, and we accepted it by both hands, and we are.
Yes.
That is why we are serving, in the sense of healthcare.
Yes.
That we can help somebody at least get out of pain,
yes,
or at least get out of discomfort.
That is true.
All right.
That is true.
But just from the cases that I have seen there,
yeah,
I have maybe saw one case that is equivalent to high levels case in Edmonton. Just because of the awareness.
Yes.
Right? Just because of the people in city, they are aware of their oral health.
That is true.
Their part in taking care of them. Whereas in high level, all those people who are living out in acreages or reserves, they are not made aware, or not everybody is that active in terms of their health.
Yes.
So the cases we saw there it would just blow your mind.
Yeah.
And it's so hard. Sometimes it would break your heart. I still remember one patient that came in. That poor guy got a work accident. So he was doing something for heavy machinery. And one of the machine's arm was not 100% tightened up. So it loosened midway, and then it came and hit his face. I still remember I took a pan, and I could see the patient literally moving the jaw like that and putting it back in place.
Yes.
And he was heavily intoxicated because of pain. He's like, as soon as he walked in, the first thing he said is, "I'm heavily intoxicated just because I'm in so much pain."
Right.
But I don't know what to do, so help me. And I remember that patient with 3 fractures that we could diagnose on that just panoramics. And that's what breaks our heart, or that's what break my heart when I saw it first, that we couldn't do anything in that particular instinct to get the patient out of the discomfort he was feeling. Because treating jaw fractures is a massive thing.
It is, yeah.
And it's a lot more complicated treatment than, say, a wisdom teeth extraction. Right? So that patient, we had to call an air ambulance and fly him over to Royal Alex to get the treatment done.
Yes.
That is one of the reasons why I liked surgery, because I have seen that part where patient suffers because of lack of treatment.
Yes.
I have also seen a bunch of teenagers coming in with a massive impacted wisdom teeth abscess, and they would be like chipmunk cheeks. Usually we get it after extraction. I have seen them before extraction. Yes. And those patients are struggling to a point where they are not able to eat or drink anything. And at that point, they are not freezing. Freezing is not, anesthetic's not working on them. Yes. They can't open. There's no visibility. There's no access. Nothing like that. And that is where we are still restricted to some kind of limitations that we can provide treatment on.
Yes.
Right? Because we don't want to force treatment on a patient who is already struggling or who is already in so much physical pain to push it to a next level of painness.
Right.
Right. And that is what brought me into the interest of surgery.
Yes.
And that is why I started doing surgeries more in Agape, like assisting with it. And I'm glad that Dr. Dea took me to so many courses regarding surgeries. So vertical bone regeneration, bone grafts, wisdom extractions, everything. I've been to pretty much all courses related to surgeries.
Right.
As a single assistant.
Yeah.
Last year, February 2024, we went to Washington for vertical bone regeneration course. And Dr. Israel Putterman, he was the instructor, and he said, "You are the first assistant to be in the course."
Right.
And then they're like, this might be the start of something that we can actually bring or encourage dentists to bring their surgical assistants.
Right.
Just so that the assistants are also aware of what happens.
Right. That's true.
And we are just not blindly following whatever the dentist says.
Right.
Sometimes complexity of a case can never be predicted.
Yes. And you need a second opinion.
100%.
That time.
And
and I've seen you a lot of times you collaborate with Dr. Dea, you'll ask her a question, you see a pen, and then I've seen you both of you discuss, over a pen that should I take a risk, or you think this is something that I can do.
Absolutely. I'm so grateful for her that she is investing in staff.
Yes.
And training the people who works in the clinic for the betterment of patients, and not just for her purposes or for her clinic's purposes.
Right.
And I can proudly say, because of Dr. Dea's investment that she does on us, we can guide even the dentists.
Yes.
Because we have seen it.
Yes. And she gives us that priority. She includes us in the conversation. Otherwise a lot of leaders are like, oh, either my way or highway. Right.
She listens. That's the most important part of anybody. That, like, if we are said one skill to acquire, I would say listening.
Listening, yes.
Because that itself, it teaches you a lot of things.
Yes.
Right. And then that is why she listens, and that is why even before she decides to do any treatment on any patient, she talks. It's like, what do you think about this treatment, or what do you think about this patient?
Yes.
We look at the ethnicity of the patient. We look at the age of the patient.
Yes.
We look at how much complex the treatment might be.
Right.
Or we might end up into a situation where we might have to get rescued.
That is true.
So we evaluate things on basis that we know can backfire on us. Right? Just because we know the possibility, or we have seen other people facing those problems, and we are learning from that mistakes.
Yes.
Right.
Yes.
But that is why the interest keeps going. Because you can never say you have seen everything.
Yes.
In dentistry.
No.
Never. You never know what a patient might bring.
Yes.
Right. I have seen like 21-year-old with complete dentures. 21-year-old. That's the beauty of high level. You see anything.
Yes.
Everything.
Oh yeah.
Right.
Even Lacrete, same thing. Same thing in Lacrete.
It's like all emergency,
like gross decay, bombed out teeth. Like even for kids.
Yeah.
And that just lack of education, oral hygiene education,
Just
right? And not enough awareness, and plus not enough care, not enough preventive care they are given. Right. We're actually really blessed that we're sitting in Edmonton. We're financially stable. We can afford health. We can afford oral health. Even oral health we can afford. But rural communities, a lot of kids out there, they cannot even their parents cannot afford it.
Yeah. Dentistry itself in Canada is an expensive healthcare.
Yes, it is.
Right. So like not everybody can afford all the treatment that they need.
Yes. And which government has realized after a long time.
Absolutely. It's like very delayed response from government.
Yes.
But at least they are now
Yes.
actively doing some efforts to fix that issue.
Right. So CDCP plan now they know preventive care is also important.
Yeah, preventive care is more important than restorative care.
Yes.
Right.
Yes.
But it's sad that still a lot of people are not aware about what can happen if they don't take care of their oral health.
Yes.
Right.
Yes.
So it's important.
because people think out of sight, out of mind. It's not.
Yes.
If it doesn't bother me, if it doesn't hurt, that means I'm healthy.
Yeah. I always say drugs are good, but not as an initial measure.
Yes.
Because if somebody is having pain, for an example, say they are having toothache, they take Advil, the pain goes away, and then they're like, okay, see ya.
Yeah.
Right? And then it's like shaking a Coke bottle and not opening the lid. It will come to a point where it'll eventually explode or break the bottle itself, right? And then we see patient with like a massive perio abscess or a massive periodontal pocket that is beyond restorable.
Yes.
Right. So glad that we have the facilities, we have the resources we need to treat ourselves.
Yes.
Keep ourselves away from the adverse effects of poor oral health. But then we are also at a point, or we are also in an industry where we can bring the awareness to the rest of the people.
Yes.
Right.
Yes.
Because especially us, we come from a country that dentistry is not a proactive measure as well.
It's not at all.
Not like Canada.
No.
Right.
No.
It's all as emergency basis. Because I still remember my mom. She only goes to dentist when she has an abscess pimple on the gums.
Yes.
And I always say her that, why don't you go early? She's like, oh, at the end we'll just take off the teeth or extract the teeth and go into dentures.
Right.
That's just a mentality of how people take oral health as. It's like we'll let it be as is, and when it's too bad, we'll just extract and put a partial plate or a complete plate in.
Yeah. No, the same thing with my experience. Like when I grew up in India, even my dad worked for a government job. He had resources, he had coverage for dental.
Right.
But you still don't go for hygiene appointments because the misconception back home people have is that the more scaling you do, it opens up the pores, and they're saying it creates more gaps between the teeth.
Absolutely. That's the same thing with flossing.
Yeah.
When I was in school, we had to bring eight patients for polished fluoride, right? And when you bring your friends, we all know how our oral health is, right? And when you recommend them flossing to avoid cavities or buildup or whatever, they're like, doesn't that create space? Isn't that physically forcing the teeth open? I'm like, it's just a myth that is I don't know how it started or when it started. But that's just a myth that everybody has in their head that prevents them from flossing.
Yes.
Right. And then we see a lot of patients with tinnitus buildup or like completely deteriorated health just because of that one myth that's embedded in their brain.
Yes.
Right.
Yes.
Yeah.
And even till today, Karma, when I ask my patient, why don't you floss? They're like, because it makes my gum bleed.
Yeah.
I'm like, you don't floss enough. That's why your gums bleed.
It's tough. Especially me when I'm also doing part-time business of photography, like video, audio and video, or photo video production. Sometimes when you have to change mentality of a person, that's the toughest thing you have to do.
Right.
Because they are used to that same situation for years, and then all of a sudden somebody completely strange comes into their life and they say, hey, you gotta change this habit.
Yes.
It's not easy for them. I don't remember who's quoted it, but it says, breaking out of the routine is the toughest thing a person goes through.
Yes.
And that is the toughest thing anybody has to do. And if you're able to do that, you will succeed no matter what.
Yeah.
Right. So it's like if we are saying who are completely strangers to them that you have to start doing something that you are not used to.
Yes.
That is initially going to make your gums bleed. That is going to put you in a place where you will feel pain.
Yes.
Discomfort.
Yes.
They're like, screw you. I'm fine right now. I'm not gonna do anything.
Yes.
Right. So bringing awareness is very tough,
Yes.
Especially changing the mentality of the
Yes,
people.
that's true.
But,
Change is hard. It takes time.
Change
Change is really hard.
Absolutely.
And now they're saying, I think university, they were saying it takes 21 days to form a habit. So if you do something consistently for about 21 days, it's after that you realize there's a part of my routine that's missing.
Yes. It's like you form yourself in a way where it becomes second nature. That you have to do it or you'll feel like something is missing.
Yes.
Right. But that 21 days where you are actually forming habit, that's the worst part to take. It's very tough to do. Even myself. I never saw dentist until I was 15. Right before coming to Canada, that is when I went to dentist for the first time in my life.
Yes.
Just because of how we were brought up, right? And then I was glad that I got the education that I have. Glad that I got the awareness, and then I started doing the things that we are supposed to.
Yes.
But initially, when you have to start doing, say, brushing 2 times a day, flossing, it's very tough to do.
Yeah.
And it's like you are like, it takes 5 minutes. That's 5 additional minutes that you were not expecting. And time anyway here, it's very bounded.
Yes.
Not a lot of people wants to do anything extra that they don't want to, or they don't have to.
Yeah, that's true.
All right.
That's true.
So breaking.
You just want to do bare minimum.
Pretty much like survival. Whatever you need for survival and steady operation of the body.
Yeah.
That's what everybody's gonna do.
Yes.
Right. All right. How was your schooling? How intense was it as a schooling or like bachelor's for RDH?
I think dental hygiene at U of A it's equally divided in semesters.
Right.
Because I think it's pretty competitive. Just to begin with, it's pretty competitive to get in.
Right.
And a lot of people don't get in because of the GPA there now. Because when I graduated, I think the cutoff was maybe 3.2 to 3.7,
right.
And now it's 3.9 GPA. You have to get in at U of A. So, but once you get in, they actually divide all the courses in equal semesters. There are other programs out there in Canada that finish hygiene in 2 years.
Absolutely.
Or 18 months.
18 months, yeah.
Or 18 months.
Toronto.
Right. So, but they cram everything in those semesters.
It kills the students.
Yeah. So it's too much. Yeah. We actually had summer breaks where we can do voluntary work or you can work part-time to make some money. And plus, we did have some downtime. Plus, they also had some rotation that they throw in, whether it's Boyle Macaulay in downtown or whether it's high level Lacreed.
Right.
It's multidisciplinary. So you get a bit of everything. You get some endo lectures, you get perio lectures, you get ortho lectures, you get oral surgery lectures. So other colleges out there, they may be just focusing on hygiene only.
Right.
But at U of A, we got multidisciplinary practices.
Absolutely. So you were already exposed to all the parts of dentistry that's out there in the industry.
Right. So they filter students in the beginning. So once you get in, you're with like-minded people.
Gotcha. So it's basically it's a filter for them. So
yes.
It's like GPA requirements that technically tests your integrity of how driven you are or how motivated
how sincere you are to get in, and plus how sincere you are to work towards your goal.
Right.
So everybody's working, everybody wants to achieve greatness in life, or everybody wants to do what you were yesterday. You want to do better than you were yesterday.
Right.
So you look at like monkey see, monkey do kind of thing, So
yeah, pretty much.
You look at somebody else, that person's doing really good. So there's something lacking in me. I've got to try my
push yourself to do even better than.
So I think I'm really blessed, and I'm really privileged that I got into U of A hygiene school. And after getting in, U of A is a community.
Right.
So everybody comes in to help each other.
Right.
And I'm still in contact with, like, I've been graduated a decade ago. So I've been still in contact with all my colleagues, even dentistry, even hygiene, you name it. So if everybody like who graduated same time as me, or a year before me, or 2 years before me, or my juniors that graduated after me, we're still tight.
Right.
Because U of A makes it like a community.
That's the best part any institute can do.
Yes.
Because usually, on a normal basis that I have seen is you get too competitive.
Yes.
And then that spoils the relationship.
Yes.
Right. Because then you're competing with your classmates, so you are breaking that friendship bond. Mm-hmm. And then you are just basically a number game.
Yes.
Right? It's like who got the highest marks or who got the highest GPA at the end.
Yes.
And once you graduate and you don't see that person often, you just lose contact. Mm-hmm. Right. Because I suffer from that. I suffer from that very reason that I just have basically one friend who I keep in touch with from my school.
Yes.
I can still talk to everybody, but it's not my first instinct that I'll go and talk to somebody.
Right.
So I just
reach out for help.
Yeah. I just have one friend who we are friends since 3rd grade.
Right.
And we are still friends. We did college, we did like first year of college together. We did schooling all the way till high school together. Mm-hmm. But just because of how competitive schooling was back then, it was just a number game, right? So it's like if somebody got better marks than I did, I would just envy them, right? And then on some level, either on emotional level or either on mental level, it'll break that freeness of friendship.
Yes.
Right. So that is, if your institute is pushing you to be together, it's the best thing they could do. And that is why U of A is considered one of the best education institute in Canada or even globally.
That's true.
Right. Because they have the most successed students who are ready for anything as soon as they graduate.
Yes.
And that's what companies or say employers outside of the institute are looking for.
Yes.
Right, because then they can count on a person to be team member as well as an employee who's going to do whatever they are entitled to do.
Yes.
Right.
Yes.
Not a lot of education institute does that.
Yeah.
I hope they start doing it soon and more often.
Yes.
Just so that if we are ever placed in a spot where there is a lot of hate, we can still survive that.
And Karma, there's a thin line. There is a thin line and also a vast difference. There's a thin line between how confidence you are and also competency.
Yeah.
And then qualification. That's also different. So even though you're qualified to do the job, how competent you are to do the job, right?
Yeah.
So U of A teaches you to be competent.
Right.
So everybody's qualified. Once you get your hygiene license, you're qualified to do the job.
Yeah.
But are you confident enough and are you competent enough to do the job?
Two different things.
Yes.
Yeah. That basically makes or breaks a person.
Yeah.
Yeah. How did you get into hygiene school, or like what was your rationale to select dentistry as a profession?
I think it's a backup plan. I feel like I landed by mistake.
You wanted to be a doctor. Wanted to go to medicine.
I actually want to do medicine. So my background before hygiene, I did Bachelor of Science at Grant McEwen. So the end goal, and then I come from a family where, you either gotta be doctor, you either gotta be engineer, you either gotta be lawyer, So
every brown family.
Yes.
It's like they just have two professions. There's like either engineer or a doctor.
Yes.
Yeah. And then even before you were born, it's like locked into your parents.
Yes.
And then they try to mold you in a way that you have to be either or. That's
Yes.
it.
Yeah,
No,
that's
no,
it.
no other profession.
You don't have any options,
Yeah.
So, but now I think that mentality changed from our generation now, Karma. It has changed now.
Yeah, it has
So we don't-
significantly changed.
Yes. So we don't look at it, I think profession is a profession. Doesn't matter what, if you work through your heart or you give your all in, I
Right.
think you can be anything.
Right.
Right. So I actually wanted to be, because that's what ingrained since my childhood.
Yeah, yeah.
So I actually want to do medicine. So I did my bachelor's, wrote MCAT, applied at U of A and Calgary, Toronto. I didn't get in because they look at everything. They look at not just MCAT score. They look at your voluntary work.
Yeah.
They look at references.
Co-curricular activities
Yes.
too, and how active you are in terms of like social works and community work and everything,
Yes,
right?
yes, that's true. And plus, and growing up, I didn't have that because they look at your high school education as well. They look at your bachelor's.
Right.
Coming to Canada, I thought it was Indian mentality from it's all academic.
Yeah.
You don't put in any other efforts to do any other activity. So and plus, I grew up. My mother tongue is Gujarati.
Yep.
So I grew up in a Gujarati medium school. There was no English language.
Yep.
So coming here, I think I did some ESL classes. I had to redo my high school again because they're saying no, it's in Gujarati.
They don't accept.
So
language,
the credits they don't get transferred.
Yeah.
So I think I focused on academic too much. I think the voluntary got neglected.
Right, and that is where you got hit.
Yes.
For med school.
Yeah, for med school. So I didn't get in. So I'm like, oh, what now? That was the only thing.
Like, what option do I have left in terms of?
But luckily, I actually I did some voluntary work with some dental clinics out there, and I did sterilization for them.
Okay.
And I'm like, I think I like this industry. I think I'll be able to manage it.
Right.
Let's give it a try.
Right.
So I applied for DDS and RDH, but they're like, dentist's like, oh, you gotta write that. I'm like, seriously? Like I have this
One more. I'm like, already.
one more exam. I'm like, I have the GPA. Like, what else do you want?
Yeah.
They're like, no, actually, the DAT is
The requirement.
It's a requirement.
Yeah.
So I'm like, okay, let's apply hygiene, and I actually did the MMI interview, the multiple mini interviews, and then the next week or next month or something, I got a email that you're selected in the course.
Right.
So that's how it started, and then I still didn't give up. I'm like, no, I actually want to do medicine. I don't know if I can do this or not.
Yeah.
So even during my school time, I was still thinking about it. I'm like, I think I'm just gonna do this for a little bit,
Right.
and I'm gonna get out of this career.
Right.
And then I applied in US, and then I got into BU, Boston University.
Yeah.
And they're like, okay, you've been accepted, and we're gonna call you for a personal interview and stuff. But you have to reserve your seat,
Right.
and that's $250 US. I'm like, okay,
Right.
that's okay. I can pay the fees, and then you can reserve my seat.
Right.
So that was reserved, and then I think I didn't do my research enough that time.
Okay.
And then I looked at the fee guide and stuff. So when they said, oh, the tuition cost is going to be $475,000 US dollars. US dollars. And that time, and now things have changed, Karma. Now you can apply for student line of credits.
Right.
That time it was you borrow money from bank.
Right. So like education loan was the only thing back then.
That is true. Yeah. So I'm like, man, I don't think I can afford that much. Even if I do go to school, it's still gonna take me 5 years to graduate.
Right.
And plus after that you have to do a residency. And then coming back to Canada, suppose if I want to practice in Canada back, I have to pass the
national license exam.
Yes, in here as well.
Yeah.
And then I have to do some internship here as well. So I think it's going to take me another 8-9 years to graduate and then start earning my way in.
Right.
And then I still have to pay the student.
Exactly. You're still in debt.
Yes.
Yeah.
And that was the time I declined.
Gotcha.
So and now after that I think I started working. So that time my heart wasn't there. as a
Right.
hygienist.
Right.
My heart wasn't there. But I think now when I realize, I'm like, no, this is the only thing that I'm going to be doing now.
Right.
So you put in more effort.
More efforts, correct.
Yeah, so
you try to accept it.
Yes.
Yeah.
So I think after that, my the whole thinking has changed regarding dentistry.
Right.
And I think I love it now, what I do.
That's very good, because that's important to love your work.
Yes.
In order for a lasting career.
That is true. Because you don't want to get up in the morning, you're like,
Again, I gotta do this
Again.
one more time
8
for the
o'clock.
weekend, right? Like you need a motivation to get up.
Yes.
Because I'm a person. I'm not a morning person.
Yes,
Like
me either.
If I have to do whole night or like pull out an all nighter,
Mm-hmm.
I can do it. But if I have to wake up, I need a solid inspiration to bring my butt out of the bed.
Yes.
Right. And so it's very important. Why haven't you after working as a hygienist for a while, why haven't you thought about becoming a dentist?
I think because how vigorous it is on your body.
Yes.
Dentistry, on the outside it looks all hunky dory, but when you get into the business,
Right.
it is tough. You have to keep up with your chiro appointments. You have to keep up with your physio appointments. You have to keep up with your massages. So
Yep.
I think you start to get carpal tunnels, tendonitis, neck problem, back problems.
Yep.
So I think dentistry it's even more tougher than hygiene, because you're doing everything.
Everything,
You're
correct.
doing complicated wisdom teeth exos.
Yep.
You're doing RCTs.
Yep.
2.5 hours it might take you to do a complicated RCT.
Right.
Right. So I think I didn't get in. I think I was thinking about it one time, but I didn't get into it because of the health consequences.
Right.
Because I think if I want to do this long run, I think I want to be comfortable with myself that I can do this for next 20 years, 30 years down the road.
Yeah. And even if the profession breaks your body,
Yeah.
then it's actually you're doing disgrace to yourself.
Yes.
Right.
Yes.
It's like when people see us as dental professionals, they're like, oh, you're making good money. Yeah,
Yes.
you're making bank.
Yes.
But then they don't see how much of a body breaking work it is.
It is, yeah.
Right. They're like, oh, all you do is sit on the chair and talk with patients and clean their teeth.
Yes.
Right. But they don't know the motion of cleaning.
Yes.
It's a repetitive thing that
Yes.
is you were doing for 8 hours for say 40 years. Once you retire, your hand won't move.
Yeah.
Because you have just exhausted the joints. You have exhausted the tissues there, that it's gonna stiffen up on you.
Yes.
Right. So it's like,
Yes.
profession is good, money is good, but it also breaks your body.
That's true.
Right.
That is true.
Do you ever regret not becoming a dentist?
No, I regret more about medicine.
Right.
But after I think I came to a term with myself now that I think the whole mentality changed after my marriage. I think after marriage, I feel like I've gone through so much up and down with my wife.
Yes.
That now I realized, live in a moment. I used to pre-plan a lot of stuff when I was new grad, and then when I was single, I used to pre-plan like 10 years from now, like this much money in the bank,
Right.
or at this time you retire,
Yeah.
or you make this much money and then you go on a trip,
Right.
Then I think everything changed after my marriage.
Right.
Because I've gone through so much up and down. So now I think at that point that now I'm at peace at myself. I think I've accepted myself now. I think what I do, I'm good at it, and I like it. Patient like it. So I used to regret it, not anymore.
Right.
I think the whole mentality has changed.
That keeps you going.
Yes.
Yeah. How has your childhood affected your career? In a way, say, way you think, the way you analyze the situation, does that make any effect on you? Especially the upbringings when we compare upbringings of current kids, or
Yes.
like kids nowadays compared
Yes.
to our time.
That's true. I think karma pros and cons both.
Right. Of course.
Because I think I grew up in like really strict household. Like 7:00 curfew.
Yeah.
You cannot go anywhere, or you respect your elders.
Yeah.
You don't talk back. I'll take on everything. You name it, belt buckles.
Everything that is.
Anything that comes to your hand. Like my parents knew it all.
Yeah.
So I think there was a sense of fear and respect.
Right.
Now I feel like that time I don't think my parents ever said I love you.
Mm-hmm.
I know they love me. They'll do anything for me.
Right.
But I've never seen my dad will come and hug me,
Yeah.
or to say I love you.
It's not common in Indian households.
Yes.
Yeah.
Yeah. So I think that's the pro and cons are both, because you grew up respecting your parents.
Right.
Nowadays, your parents are your friends.
Yeah.
Everybody has the right to voice out their opinion.
Right.
Now,
Yeah.
So before, as a kid, you were neglected. You're like, no, you know what? You're going to do what your elders going to.
Yeah. What are you going to tell?
Yes.
Right.
Yes. But now, even you ask opinion for a little kid as well. You were given them a choice.
Right.
What color do you want? Suppose you're serving. I was talking to Dr. Linda Land the other day.
Yeah.
And she was talking about how kids nowadays are offered choices.
Right.
Or do you wanna milk in a blue bottle or a orange bottle?
Right.
So that time you just give
whatever you get.
You get it, right?
Yeah.
So I think pros and cons both, because I grew up in a household where you respect your elders.
Right.
So you give respect and you take respect.
Yeah.
But kids nowadays, I think that part is missing.
Yeah. The respect.
The discipline factor is missing.
Yeah.
Now, but I think you can now. The time has changed. You cannot raise a hand, or the way we grew up. I don't think you can grow your child nowadays.
Yeah, you can.
You have to find a balance between. We grew up in like extreme.
Right.
And nowadays there is other extreme that you spoil your kids so much.
Absolutely, and then sometimes it backfires on you like really bad.
Yes.
Right. We were raised in a way where we had no choices given.
Yes.
You were said what you have to do, and then you'd have to just blindly follow. Doesn't matter what your likes or what your dislike is. Doesn't matter.
Yeah.
Right.
Yeah.
I feel that makes you more tolerant to everything.
Yes.
Right. Because then
100% agree, Karma.
If you don't get choices, you become creative. And then you make your own choices in the choice that you were given.
Yeah.
Right. Whereas especially the kids nowadays, they get bored super fast.
Yeah.
Because they have so many options. It's like they have so many varieties of toys that they get bored out of it.
Yes.
Whereas we were just given one toy and we used it like it was 10 toys. We made our own toy out of that one single toy.
Yes.
And that is where you form that creativeness, you form that persistence not to give up on anything. Right?
Yes.
I hope that we can teach our kids that factor.
Yes.
Without inducing trauma like we went through.
Yes, that is true. And considering and talking about trauma, Karma, I'm going to add this. Now there's awareness of mental health as well.
Right.
Because the way we grew up, there was no such thing as depression.
Yeah. Like go sleep, wake up tomorrow, you'll be fine.
What do you mean you feel sad? Sadness or depression, anxiety, nervousness.
Right.
There was no such concept when we grew up,
So true. That's so true.
So now I think now as this generation where we grew up in a new environment now, I think we have to realize that mental health is also a biggest factor in life.
Yeah.
So you don't want your kids to be depressed.
Right.
We used to take it all in, but we are a 90s generation, that's something else, but now Gen Z's, beta generation, they're not gonna take it.
Yeah.
I think the new generation is much more sensitive.
Yes.
So if you suppress them too much, I think it can blow out of proportion.
Yes, that's true. Talking about our time, so say 90s compared to right now, how do you think our profession has changed from 90s to current, say 2025? How significantly has it changed? Or don't even say 90s. Consider a time when you graduated, because you've been working as a hygienist for over 12 years now, right?
Yes,
12, 13
over a decade. Yeah.
So how has the time changed the way dentistry flows?
Oh, since even talk about you said like when I graduated, I think we had the technology at that time.
Yeah.
But before that, I think dentistry has evolved not only technology wise, but even empathetic.
Right.
Now we look at patient needs. So it's research based patient centered care.
Right.
Before, dentistry was like, this is what we've been taught in school.
Exactly.
And this is I'm going to perform.
Yeah.
I don't care what your needs are.
Yeah.
Or I don't care what you are saying, what your
right.
financial, how much you can afford financially,
right.
Or
this is the ideal treatment, you're going to do it.
Yes.
Yeah.
And I'm going to do it regardless.
Yeah.
So I think when I was in at U of A, that time technology was evolving, but it was actually new.
Right.
So we were the first batch going from films or paperwork to digital sensors.
Yeah.
And K-Clinic was brand new build that time.
Right.
So even professors are not used to of it. Even for them, it was a learning curve.
Right.
And for that generation to adopt to technology, we can adopt faster.
Right.
But for professors to adopt to technology, that time was even tougher.
Yeah.
They come and talk to us because that time we had Axiom program.
Right. Yeah.
And then they'll come and talk to us, how can I log into this? Or
right.
how can I change the charting? Or what are the procedure codes that I need to enter? Or how can I enter the surfaces
right.
on the tooth,
Yeah.
So professors, I think we worked along with professors to figure out the whole technology part of it.
Right.
So I think the technology has changed, but more than that, technology is going to evolve over time. That's good.
Yeah.
But as a human being, we also have to evolve.
Yeah.
So I think dentistry has evolved as a human being as well. So I think that more dentists out there are more empathetic now.
Correct.
So because I've seen in my practice that a lot of people that they come to me and they're like, Chet, we read reviews about Agape. I'm like, because I asked them like,
how did you find
us?
Right.
Where did you hear about us?
Right.
And they're like, I read the reviews and I'm here because I'm really anxious and I have dental anxiety.
Yeah.
And I've been to a lot of dental clinics out there, and in my past, I had really bad experiences with dentists.
Right.
And they tell me on my face, they're 100%. Like, Chet,
that's why we don't come see you. Like, don't take it offensive.
Yeah.
Like, none taken, but
I'm
it's
like,
still. Like, what do you mean you don't like seeing us?
So they're like, Chet, don't take it personally, but I don't like you. I'm like, that's okay.
Yeah, because we know, dentistry back in the days was very tough.
Yes.
And patients didn't get much opinion or no respect for their opinion.
Yes.
Right.
Yes.
It is because same thing. When we are seeing a patient, we see with severe anxiety, right? The patient's shaking in the chair, and at that time we think, how do we convey to the patient that you need extraction?
Yes.
When patients already jumping.
Yes.
Right.
Yes.
So that is like we have to think how to tell them without making it worse on them, because they are already at a place where it's not their preference.
Yes.
They are only in your chair because they absolutely have no other option.
They
left.
have to be there. Yeah.
Yeah.
And they know the worst news is coming.
Yeah.
They hype up their self already.
Yeah. Like, overthinking is a key sometimes that kills the cat.
Yeah.
Like a lot of patients that breaks a tooth that comes in, they're like, I need an extraction. They have never thought about getting a filling. They have never thought about treating the tooth with a root canal and saving it, right? Because in their mind, they're like, oh, this is the worst I can get my tooth to. And then the last resort I have is extraction.
Right.
And sometimes when we say, oh, we can save the tooth, it's very helpful for them. And they're like, oh, I wasn't expecting that, but I will do anything to save the tooth.
Yes.
Right.
Yes.
But thinking how the patient is going to react is first thought that comes into our minds now compared to back in the days, where a dentist looks at the x-ray and they're like, okay, broken tooth, it's close to gingiva, extraction.
Yes.
And we can't restore it.
Yes.
And then no matter the situation of a patient, it was the only treatment that was provided to them.
Yes.
Right. When you were in transition from, say, from analog to digital, as a student, tell me a couple incidents that were actually funny enough that got engraved in your brain.
Oh, because I never did analog. I would never, because my seniors, they actually had learned it. Right. And then my batch was first one to go to.
So you started just digital.
I started digital.
Right.
So I never. The first time I touched the films was at high level.
Right.
In my rotation.
Right.
I'm like, you taught us sensors, and you put us at a satellite clinic where there's only
like just
only
paper,
films.
pen, paper, and films. Yeah.
Yeah. So that time I learned how to do the analog.
Right.
But until then, but learning, I think the funny thing was learning on a Dexter. And because you cannot radiate your fellow classmate that time, so that time you go to a sim lab or go to your radiation lab, and then you do exposure on Dexter.
Yeah.
But the Dexter we were given, the TMJ was really solid that time, and
tough to open.
And then I remember my first day when they said, you know what, we have a radiology lab today, and then we're gonna learn on sensors. So we're going to start with the quad 4 bite wings first.
Right.
So I'm like, okay, how hard can it be? Okay, I got it.
Yeah.
And then plugging in USB cord, that's all standard. That's all standard. That's okay. That's no big deal.
Yeah.
But I put it in, and then I couldn't close Dexter's mouth, and it was so tight, and so. And I don't want to look dumb, so I don't want to go to professor again. It's like, oh, sorry, I cannot. Can you hold it?
Yeah. The most embarrassing thing you can ask. Can you help me close this?
Yeah. And I think the funny thing was, I actually, so you're supposed to close the mouth, and then you go behind the lead wall and you press the button.
Yeah.
And I was so embarrassed because I as soon as I close it, it'll shut open, and then I close it and it'll open up again, because that muscle, I don't know, something, or maybe I wasn't doing properly, or maybe I had to lock some kind of a lock nut maybe on the back or something that
just to keep the jaw closed.
Yeah, so close. I didn't know that.
Yeah.
So what I did, I'm like, you know what, nobody's watching, so I'm just gonna stand here.
And take an x-ray, holding the jaw.
And I'm going to hold the jaw, and I'm going to take an x-ray. How hard is it? So, and that time, we didn't have the XCP.
Yeah.
That time. We had to like eyeball it. So
visualize it.
You're going to visualize it, and then you're going to take it,
Yeah.
So I took it. And then we have Dr. Senior, Dr. Anthea Senior.
Yeah.
So Dr. Senior comes in, and she was gonna grade us, like how the bite wings were done. She was gonna grade us on that.
Right.
So they're like, Chet, everything is okay. The contact is proper. There is no cone cut. Everything's okay.
Yeah.
But I see something white underneath that. I don't know what kind of shadow is that. Looks like a bone, but
oops, that's my hand.
But I'm like, and then I'm all naive about it, I'm like, I don't know what that is. and then she's like, Chet, looks like a palm, like it looks like.
Oh.
And then I'm like, you know what? Sorry. I'm like, really sorry, professor. I'm going to come clean. I couldn't keep it shut. So I was holding it with my bare hand. And so like, Chet, you're taking radiation. I'm like, yeah, I know. We're supposed to go behind the lead wall.
Yeah, I had to pass. I had to do something.
So she was like, Chet, it's okay. Like, at least you're honest about it. I think she passed me after that.
Yeah. Oh boy. That's a way to learn. Where you still get positive reinforcement.
Yes.
Right.
Yes.
It's okay, I mess up, but I wasn't aware of what other options I had.
That is true. Yeah.
Right?
Yeah.
I remember.
You have to own up to your mistakes. Right?
100%.
Yeah.
The funny thing that I remember from my college is when we just had one clinic, right? And hygienists, students, and assisting students used to share the clinic. And so we would have our clinicals in the morning till noon, and then hygiene students would have their clinicals from 1 to 5.
Right.
And one day I remember I went into the clinic to pick up my assignments, and I saw a hygiene student doing scaling on a dexter, and she was said to do quad 2 scaling. And her dexter was completely upside down on the chair. And I for a second I stood there and I was like, what is happening? What is she doing? I'm like, dexter's completely upside down, the chin's towards the student, right? Like head's on the chair that is like completely almost about to fall off. And I was standing there, and one of the instructor saw me that I'm looking at something confused, right? And so she came over, and she looked at the student, and she was also same exact baffled like me. She stood and she was also looking at the student. And we both are like, what is happening here? Like, we have no idea. And
so you're treating quad 2 as quad 4?
So the instructor goes to the student. She asks, like, what is happening, right? What are you doing? What is the thing that you are trying to do,
right,
with upside down dexter? And she is like, oh, I'm very poor in indirect vision, so I made it direct vision. The instructor lost her mind. She's like, okay, so think about this as an actual patient. How are you gonna turn the patient upside down to treat quad 2? The student, she got unsatisfactory in that particular test. I feel sorry because still I feel like that was my fault, because I was standing there in a way that instructor saw me, and then she came and saw the same thing I was looking at.
Yes.
But we both were equivalently baffled of how the creative the student was, that she turned the dexter upside down to achieve what she wanted.
Yes.
Right?
Yes.
But I can never forget that. I'm like,
desperate needs.
What, exactly. Like, that's one way to do it, right? Like, you have dexter, you can flip it. Why not? Right? Might as well. When we were taught to take X-rays, our dexter was the opposite way. So every time we had to do it, there was a screw on the back that we had to physically tighten up.
Which we had too, Karma. But I didn't realize you have to do. You have to turn that angle. You have to turn that screw.
Tighten it up. Or
so I'm like, man, I don't want to be dumb. Like everybody knows how to do it. I don't want to be the first one to go to professor and say I cannot close the jawline. So you know what? I'm gonna start it close.
Sorry, I'm just gonna take matters into my hand and take an X-ray there. Oh, that's funny. Tell me one example of something that patient said to you that completely blew your mind.
Funny story or like
anything that you were completely awestruck by the thing. You were not expecting that, and all of a sudden the patient just dropped that bomb.
Oh yeah. I think this was at U of A, and I still remember. I think that was my last patient for my credit that I had that VD required.
Yep.
Because we had to finish class 1, class 2, and class 3 patients. So depending on a perio stages, and then on the tartar buildup, we had to finish those kind of requirements. So I had a 65-year-old. And because I guess dentistry is affordable at U of A, so people who don't have insurances
they become
or before, and plus who have time in their life, we see a lot of seniors.
Because you're called anytime, right?
Yes.
Yeah.
And plus you have to spare 3 or 4 hours of your life, the whole afternoon, so you have to be patient. And then you have to come there, you go through screening protocol, you sit in the chair, we do our work, and then professor come and they check it again. So there's like 3 or 4 protocols you have to go through. So it takes about 3-4 hours to finish the patient. So he actually he comes in, he's like, oh, okay. So I'm like, oh, I actually needed, so he was one of my patient, and then I'm like, I actually needed class 3 patient as my requirement for a perio requirement. So would you be able to come in and you think you'll be my patient so I can get those requirements? It's like, oh yeah, Chet, I can actually come in, no problem at all. So he actually he's like, you know what, so I'm like, okay, so you have grade 1 and grade 2 mobility of the teeth, so we're going to try our best. We can hold on to it, but you have to come in every 3 to 4 months for hygiene. So we're going to try our best and we can hold on to your teeth. And I think he was missing bunch of teeth, quad 1, quad 2, and he had probably 6 or 7 left in mand. And then upper, he had probably about 8 or 9 teeth left. So I'm like, whatever you have left, we're gonna hold on to it. We're gonna keep it clean, and then once everything is done, we're gonna get you a partial denture. It's like, okay. I'm like, okay, so I did probing. The initial assessment was done. Probing was done. EOE, IOE was done. The medical history was done. And then we go over the diet and so that time we also had to do if they're taking what kind of diet they are on, so they're getting enough protein or minerals or carbs or they're taking the holistic diet. So we also had a dietitian that comes in, and they're also requirement for us to finish that. So nutrition counseling was also done. Tobacco cessation counseling was also done. And then I'm like, oh, okay, so now you are a perfect patient that I screened you, and you were considered stage 3 perio. So you're gonna come in on this day. I'm gonna book an appointment, and then you come in, and I think it's gonna take about 2 to 4 hours because we're gonna do full mouth LA. And this was my second year. So just before we graduate. And then once we're done, and then I think you just have to rinse with warm salt water, or if I feel like, we're going to give you chlorhexidine mouthwash after that. And then I'm like, okay, I'm so excited. And then I'm like, okay, so I'll see you then. It's like, yeah, I'll see you then. So the day comes, I set up everything. I had my LA syringes. I had a cassette. I set up everything. So I started doing medical history screening. And then that's done. I did the blood pressure and everything. So that's done, and then I lay them back. I'm going to start with external or exam. I'm going to start with EOE. Is it okay if I check it? So I checked everything, checked the TM and everything. I'm like, okay, I'm going to do IOE now. I'm going to check, and then he opens his mouth, and no teeth there. I'm like, sir, what happened? Like, it's like edentulous patient, no teeth at all. And I'm like, what happened? And he's like, oh yeah, I forgot to tell you actually. After I saw you last time, my son took me to a dental clinic nearby my house, and he said, oh, you have severe perio, grade 2 mobility, and then I think you are best candidate for a full mouth denture.
Like, sir, I was here trying to save the teeth, and you got the full denture. Like, what?
So he got serial extractions done, full mouth exo, and he had upper and lower full denture.
At least he showed up.
And he showed up. He showed up for the appointment.
There you go.
And then, and he actually took the dentures out before the appointment, so, and then he opens wide. I'm like,
Doesn't look right. Am I tripping?
am I on drugs or?
He at least he wanted to say that he got extraction face to face. I would see Chet and tell him like, sorry, this is what I did.
So I call my professor. I'm like, this is what happened. He's like, Chet, that's okay. We're gonna figure it out what we can do. I'm like, and I was freaking out that time. I was
because then you lose a requirement.
Yes.
Right? Oh man.
I'm like, I'm done. I don't think I'm graduating now.
Did you? Because from my experience, when I was first taking X-rays on kids as a student, right before graduating, I had a 8-year-old and a very very sweet kid, right? And I was putting the sensor in his mouth, and then I asked him to close. But I wasn't as fast as that time that I am fast right now, right? So he just chomped on the sensor without realizing I had my fingertip in it. So he almost ripped up my tissue all the way until where you can feel the bone if you press it.
Wow.
Do you ever ended up in that situation?
No, because I think the most kids I've seen was in high level lacrete.
Right.
And I guess right now in my practice, I mostly don't see kids. I mostly see like 12 and 13 and up. But I've never been in that situation. But what I appreciated in high level lacrete, kids there are really disciplined.
Oh, absolutely.
Really well behaved.
They are tough, man.
And they can take it.
Yeah, like whatever you do, they're not gonna say no to you.
No. So I've seen and I've heard a lot of stories from my colleagues, from my co-workers colleagues, and even my classmates. I've heard them say, I've been chomped by a kid.
Yeah.
But I've never had that experience because all I had was good experience with the kids in high level lacrete.
Right.
And after that, I barely see kids in the clinic. So
that's fair.
Yeah.
As a
hygienist. But I appreciate it because when I compare, when I've seen kids get cranky when kids cry, and when they need nitrous or when they need any kind of sedation, and I've seen the other extreme where in rural communities,
perfect kids.
Yes.
Perfect kids for treatment, especially for us, where they don't throw tantrums at you.
Yes.
It's like,
yes,
whatever you say, they look at their parents, and if their parents say you have to do it, that's it.
Yeah.
Right.
Yeah.
But I was a lucky one. That kid almost had my finger off. But that was the first and last, and then I developed the skill of speed.
Yes.
And now every time, if I think that it's gonna happen, I'm fast enough to take my fingers out. Right.
Yes.
That's sometimes when a new student is thinking about dental professional, that's what the first question I always get asked, right? Have you ever ended up with something that bit you? Like anybody as a patient who bit you? Like first and last time, like right before graduation, that was it.
Yes.
It doesn't happen often, but it happens once in a while.
Yes.
So it's like depends on how worst of a day you are having. You might end up in that boat. You might not end up in the boat.
Yes.
Right. So say if you were approached by a fresh high school graduate, and they are asking to you about what profession should they take.
Yes.
What would be your input to them? Or like what would you say to them in order to guide them to the right path?
I think a lot of times when I see high school kids, and when I have a conversation and I ask them like what's the next step? What do you want to do?
Yeah.
And they're like, I don't know what I want to do in my life.
Yeah.
And what I tell them, if you don't know like what you want to do, if it's not clear, take a break.
Yeah.
Take a year gap.
Yeah.
Or or sometimes people already know what I want to do, they're like, my parents are saying this, or my parents are saying, this is a good career, or this is gonna make the most money. As soon as you graduate, you're gonna have a job lined up, and you're gonna have a satisfied living. I'm like, no, don't. I think follow your passion,
right?
Because the mentality I grew up in was, strictly choose a career which is evergreen.
Yes.
Choose a career that's not gonna have economical downfall or like no recession. So they're saying, medical is the best bet.
Yes, healthcare is like, doesn't matter whatever happens outside in the world, you still have patients.
That is true. Yeah, but I feel like we need all sort of people in life. In society, we need
balance.
Yes, that is true.
We need balance of like healthcare people. We need balance of like mathematical people.
Yes.
We need balance of artists too, at least to keep us entertained.
That is true.
Right.
Yeah, that is true.
We also need somebody who is smart enough to manage everybody.
Yeah, that's true. We also need office managers, right?
Right? Like,
we need HRs,
Yeah, it's like it's not easy for everybody to work in a cohesive manner until we have a strong leader who's like, okay, delegate the duties or keep the hate out of the workplace.
Yes.
And I now being a lead assistant in a clinic, I get asked a lot of the times from parents, like, is dentistry a right field for my kid?
Yes.
I always say that ask your kid how they feel about dentistry.
Right.
Because not everybody would be interested in going patient's mouth.
That is true.
Because when I was in 5th or 6th grade, I hated that. I'm like, oh, you work in patients, you work in people's mouth.
Yeah.
What is that?
Yeah.
Right? But then when you pay attention to it, when you understand the significance of it, then your perspective changes.
Right.
So I always say, ask your kid how they feel about the profession. If they are even if they are a little bit skeptical, I would say let them browse their options.
That is true.
Right.
Yeah.
What would you say to a brand new hygiene graduate student, like just out of the college in say less than a week, and it's about to start job at a clinic?
I think I would say don't work for money.
Right.
I would say, a lot of people when they graduate, they're like, as soon as they graduate, like, I'm going to do 12 hours, 10 hours,
right.
6 days a week. I'm going to pay off my student debt.
Yeah.
So I feel like try to be competent in your job, try to do more CE courses,
right.
Or try to be better than what you were yesterday.
Right. Compared to yourselves, not to other.
Yeah. So don't focus on anybody else's work. Focus on yourself.
Yeah.
Dentistry is that alone. It's already competitive world.
Yes.
Like every single corner has one dental clinic.
Yeah. Every block has two now, especially the corner that I live in.
Yeah.
Every direction has 2 dental offices in the corner.
Yeah. So I feel like I'll tell them, don't, work on yourself first.
Right.
And don't go after money.
Yeah.
So if you're skilled enough, money will follow you.
Absolutely.
So work on your skills first, because once as a new grad, you have all the book knowledge, right? You qualified, you know all the terms, all the technology, everything.
Right.
But hands-on skills are missing.
Yes.
Because you don't get exposure to that many patients.
Yes.
And then you're thrown into a world where you're saying 8 people, 10 people, 12 people a day.
Yeah.
Right. So make sure you hone your skills first.
Right.
And then, so maybe start working part-time or start working different clinics,
right.
See your environment, meet your colleagues, like how the industry works,
right.
What the priorities are,
right.
And see what your own priorities are in life.
Yeah.
Because you have to keep that balance.
Yeah.
Work life and family life balance.
Yes. How, because you work 6 days a week.
Yes.
How hard it has been to maintain that balance of work and life balance?
It is hard, actually.
Right.
It is hard, but I've been doing it for more than a decade now. So you get used to of it after a while.
Yeah.
But I think I'm doing it, but I wouldn't recommend others to do
yes.
it. Others to follow my path. I think you need a break in between. One day is not enough to recover.
Yeah, especially the profession that is bodily breaking.
Yes.
Yeah.
Yes, I think a lot of new grads, I was same way. So when I graduate, I'm like, I'm gonna work 6 days a week. I'm gonna do like 10, 12 hours a day. I'm gonna pay off student loan.
Yeah.
But then I realized, all of a sudden carpal tunnel kicks in.
Yes.
Right. So tendonitis kicks in. Your neck and back hurts. Right.
Yeah.
And that time I wasn't aware of you have to keep up with the other medical professional as well. You have to keep up with your chiro.
Yeah.
You keep up with your massages. You keep up with your stretching, yoga. You don't realize that in the beginning, but now when it hurts, then you realize, man, I have to keep up, because when you're young,
everything is okay.
Yeah,
because you heal fast. But then if you do the same thing over and over again, it's also gonna take you to a point where there is no return.
Yes.
Right, and then once any systemic problem arises, then you're just stuck with it for the rest of the life.
Yes.
So it's like you also don't want to jeopardize your career. You don't want to jeopardize your life for that initial part where you are still figuring out how your body will react to a long-term part.
Right. Yeah. Another thing I will tell new grad is that don't be afraid to have a change in life.
Right.
A lot of people wants to do just grade 1 perio patients, or just I'm just going to work on kids, or I'm just going to work on, bare minimum patients, do some perio patients, do different patients, do some full mouth, traditional braces patient.
Yeah.
And how hard is to get the piezo inside, with the brackets on, with the wire on. So I think I'll tell the new grads to, explore more things in life, not just standard patients where, I've seen some offices where 2-unit scaling you're done.
Pretty much, yeah.
Right?
Yeah.
They probably got maybe slight granular calculus buildup,
Yeah.
And our practice, we see about 80-90% perio.
Anything and everything.
Right?
Pretty much.
So I think what I'll tell the new grad is explore before you get stuck at one practice.
Yeah.
Have experience, maybe temp at different clinics.
Yeah.
And then pick something that you are comfortable with.
Yeah. I had a question because thinking about temps, how was the situation of temping back when you graduated?
Oh, that time, I think I hadn't seen that many temps that time. That time was either full-time or part-time hygienist.
Right. There was only 2 options, right?
Yes. Yeah.
Because of the involvement of social media, and a different platforms where we can communicate with each other. There is a platform for offices for clinicians to say they are available to do a shift.
Yes.
Or for an example, a clinic is looking for a help. I feel like that is very helpful in terms of new graduates, because then they can see different environments.
That is true.
They can see different kind of patients, different demographics of patient, even different dentists and how different clinics work.
Yes.
And their work style, or say their systems. That right out of the gate, it will teach you a lot of things in a very short time.
Yes.
Whereas if, say, we were just stuck with one clinic, we would be pro at that clinic's systems.
Yes.
And the clinicians or that dentist's styles. But then we wouldn't know how dentist next door functions, or how different approaches were taken for different types of treatment. Because when I graduated, I didn't have that, because back in high level we just had one clinic.
Yes.
And that is all. So we were, especially me, I was so used to the style of Dr. Hammond, just because I was only assisting him. And then when I moved to Edmonton, I got experience assisting different dentists, even in the same clinic.
Right.
Because then you also have a system of associates here.
Yeah.
Right. Whereas smaller communities, like smaller towns, smaller cities, they don't have that much of associates.
Right.
So it's like one owner and another dentist who are full-time there. So you basically get locked into the skill set of those two clinicians.
Right.
Whereas here, you get exposure to a lot of different dentists who have different styles.
Right.
And you also get exposed to a lot of different demographics of patients.
Yeah, that's true. And Karma, you're right. Like 10 years ago, nowadays, you said technology, social media evolved so much.
Yep.
That time it was hard. Suppose somebody calls in sick.
Yeah.
You're done. Like you have to call your patients, and reschedule it.
Yeah.
Now you can find somebody who is readily available, right? So 10 years ago, that time, if hygienist calls in sick, then you have to cancel the whole day.
Yeah.
I barely seen people temp at different clinics, but now I've seen a lot of people temping nowadays.
Yeah,
and I've seen some hygienists that just temp.
Yeah, that's surprising, and they make more money.
Yes.
I'm like, okay, you go to different offices every single day. It's good for you in terms of exposure.
Yes.
But how about the stability? What do you think on stability for a person who is just temping?
I think if you're just in it for money or if you would just want to do it for like short term, I think that's okay. But long run, I don't think you can just keep temping.
Yeah,
that's my opinion. A lot of people have different opinions, but I think suppose somebody coming from a mat leave, or they're looking to settle down,
right?
And then they're looking for a new clinic, suppose,
right?
Or somebody just quit and then they want to take a break and they're coming back to a profession again,
right?
Then maybe I would say, you were temping for a while, but for I don't think you can do it for a long run, temping, right? Because the stability is not there, like you said, Karma. Because each morning you wake up and then you go into different clinics.
Yeah. So you don't have basically a family atmosphere.
Yes.
Right. Because you're technically new to every clinic you go to.
Right. And the patient rapport is not there. Right.
So you don't know how the patient's history is. Personally.
Yes.
Like you can look at the chart notes and you can look at the med history and everything.
Yes.
But you don't know how a patient is in terms
that personal connection is not there. Yeah.
In terms of personality. I 100% agree with you that if somebody is, say, just getting back from mat leave, or they are new into profession and they are still trying to figure out what is the best for them.
Yes.
That would be the ideal situation for them to temp.
Yes.
But what I think personally is how we grew up with mentality that we need stability.
Right.
A lot of recent graduates who are like, say, 20 years, right? They have different mindset.
Yes.
They want something new every single day.
That is true.
So they don't prefer stability over adventure.
Yes.
So
yes.
How do you feel in terms of that? What do you think is good in terms of stability for workplace or everyday adventure?
I think I'll go for stability.
Yeah.
Because I think since I graduated, I've done some temping in the beginning.
Yeah.
But since I'm hired at Agape, I'm there ever since.
Right.
And I've seen a lot of my classmates, they've gone to 2 or 3 or 4 different dental clinics, so forth.
Yeah.
So in 10 years, they've changed a lot of clinics.
Yeah.
And I feel like I started it there, and then I think I got lot of chances to evolve myself and learn. So I think I would, as a person, I think I like stability in life.
Fair.
I don't like jumping clinic to clinic where I have to figure out, And then I also like when patient recognize you.
Yeah.
As soon as they walk in.
Absolutely.
And patient know what to expect, and I know what to expect.
Yes, I have seen. You have more patient base compared to some of the dentists.
Yes.
People especially come for you to the clinic.
Yeah.
Because they were just recommended by other patients that we already have in the office.
Yes.
That go to Chet. He is your guy, especially anxiety patients.
Yes. Yes.
So that is important in terms of having a loyal patient base.
Yes.
Right, because then it keeps you motivated.
That is true.
And then
that's the exact what I was looking for. Yeah.
And then you also develop that personal connection with the patient itself.
Yes. Yes, and I like the rapport. Like when patient comes in, and I know the history, and I've seen the kids grow up.
Yes.
And that brings us to how old I am.
It just takes you back to the clock.
Yeah, Dr. Daya refers me from Jurassic era.
You belong in the museum. Because technically you are older than everybody at the clinic.
That's true.
Right? Because you have worked there the longest.
Yeah.
Now, last few questions before we end. What do you think are common misconceptions about hygiene or hygienists in general?
The main common misconception is we just do cleanings.
That's true. Like a lot of people just take hygienist as a cleaning person and nothing else.
Yeah, no.
Like we just
there is no holistic approach. There is no oral health to oral health approach. I'm just here for cleanings, and sometimes I just go along with that story.
Sure.
I'm like, okay, we'll do this. We'll just do that. But there's more to that. Oral hygiene is as important as your oral health as well. They're linking a lot of periodontal bacteria to your cardiovascular health,
100%.
Your gut health.
Like the more study comes out, the more link-ups or more connection is established between oral health and overall systemic health.
Yes. Yeah.
It's tough, eh? Like, just here to see you twice a year just for cleaning. That's it.
Yeah. And I have some patients, they're up and honest, and they're really honest with me. They're to my face. They're like, Chet, I know you're gonna give it to me again, but but I'll try to floss. I'll try to brush. Okay, no promises. I'm like, okay, I'm not gonna be the broken record again. Every time you come in, I'll give you the same lecture.
That's true. Hey? Reputation is a part of our job.
Yeah.
But not to every single patient every single time.
Yeah.
Right? Like we need somebody to follow what we say sometimes so we can see the difference.
Yeah.
Or else it's like, same records I say to you, same records you say to me. Like just equal out. Right? That's funny. Now before we kind of wrap up this episode, anything you want to say to general public that are not into dental industry at all? So say if it's just a high school graduate just listening, or even say not even a high school graduate, like anybody who's listening to this right now, what do you want to say to them in terms of our profession?
I think our voice is still not heard universally or globally or like even federally.
Yep.
So I think we need to spread more awareness about oral health and systemic health. A lot of people take us for granted, because it's a private industry, it's not a universal care.
Yeah.
So people still are not aware of it. Mm-hmm. So I feel like new graduates, like kids nowadays, I think they should get involved in spreading awareness.
Right.
Even break that change from that older generation. If it's you go to dentist only if it hurts.
Yeah.
Or it's not bothering me, so why do I care?
Yeah.
So break that chain, and I think spreading awareness plus. Suppose if you're going into politics or like social work, lobbying also important.
Yes.
Lobbying for oral health, preventive care, because that is necessary.
Yeah.
And because I feel like as a human being, everybody should get at least some kind of preventive care.
Right.
Everybody's entitled for the preventive care.
Yeah, and they deserve it.
They deserve it.
Yep.
Right. So a lot of people cannot afford it nowadays, and dentistry alone is expensive.
Expensive in general.
Right. So especially in Canada.
Yeah.
Right. So I think the kids who wants to spread awareness, I think they should, or somebody who wants to get into politics, or somebody wants to get into social work, not just dentistry. I'm not saying just dentistry business alone.
Yeah.
But I think other sectors as well, they can also and try to spread awareness.
Right.
Lobbying, or oral health is important. Spreading their awareness to the government.
Yeah.
So they can put in more money toward dentistry.
Yeah. That
because I think we don't get federally. It's underfunded.
Correct. Even I completely agree with you that we need a lot more hands.
Yes.
In order to bring awareness that we need.
Yes.
Because everything is connected, right?
Yeah.
Our oral health is the first entryway to oral health. And a lot of people still disbelieve that mouth is just something that we eat, used to chew food.
Yes.
But they don't understand when we swallow food, a lot of things gets mixed into the food and then it goes into the body.
Yes, because digestion starts from the saliva.
Exactly.
Right.
So there's still a lot of misconception about oral health out, and 100% agreed that we need a lot more hands.
Yes.
A lot more people from outside dental world to bring awareness to general people.
Yes, and also supporting these kind of platforms. And Karma, I'm really glad you started this kind of platform. Dental industry, like you said, it's a tight community. But the awareness is not there.
Yes.
Like maybe we know people from dental industry, or like some people will know us here and there.
Yeah.
But general public, the common man doesn't know.
Exactly.
Right. So you need to support this kind of platforms.
Yeah.
So when people say like, share, and subscribe, they're like, whatever.
Yeah, exactly. It's now the world of YouTube has significantly benefited, but it also has made people partial in terms of what they accept.
Yes.
In their everyday life.
Yes.
Right. That, like you said, share, comment, subscribe. It has become completely useless in terms of people's attention grabbing.
Yes.
It's like you just unconsciously ignore that.
Yes.
Even I do that.
Yeah.
I'm starting the same thing on that platform. But if we say I am just a viewer or a listener, I would just ignore that as well.
Yes.
Okay. So it's like it takes a lot of efforts to kind of reach to a point where we actually grab attention of people. And I'm trying to do my very best to be that medium that we can just bring awareness out in general market.
No, that is true, actually.
General public, because dentistry, like, yes, we would be bound in the dental world itself.
Yes.
Unless we have help.
That is true.
In order to expand the awareness into general public, right? And that is why this initiative that I started, I hope it reaches to general public.
Yes.
And not only to dental professionals.
That is true.
Because it is important.
Yeah.
And I want each and everybody to be as healthy as I want myself to be.
That is true. Yes. Yes.
Right.
Yeah.
Now, last question for you, my friend. One small tip that you want our listeners, our viewers, to know before we call off this episode.
Regarding life or dentistry?
Anything. It can be your life experience. It can be.
I can talk about my life. I think. I feel like I learned the hard way now, so as I think the maturity comes after a while,
like the more you see, the more mature you get.
Yeah. I feel like what I want to say to people is that be humble, live in present, and don't plan about future. Enjoy today, enjoy the moment. Like I'm sitting with you right now, and I'm enjoying what I'm doing right now. I don't know what I'm gonna do tomorrow. Right. So before I used to plan so much, I used to plan 10 years in advance, or my retirement in advance, or this much money in the bank. But now I feel like you should live in the moment or in the present right now. Make the most of it.
Yes. Perfect.
And last thing to the viewers, support platforms like this, Karma, so that you have that drive, to keep going, So you started this to spread awareness of dental industry, how, or the oral hygiene awareness in the market right now, right? So I think I tell people to support this kind of platforms, so you can keep going, and you also learn more valuable things down the road as well.
Absolutely. I always say that I personally don't care about where the person is at the point, at current point.
Yes.
I always fancy the journey.
Yes.
Because everybody's journey is different. Everybody has their different paths taken, and they faced different consequences.
Yes.
And there is so much that we can learn from just those stories itself, those journeys, and people just sharing their experiences. Compared to looking at their position at the end.
Yes, that is true.
Because everybody has different dreams. Everybody has different way to cope up with different situations. And that is that is one of the reasons why I started this a podcast, is that I could share those journeys of people who are already in the industry, who have reached to a point where they have established themselves.
Right.
But just by those journey and that experiences, a lot of new people who are just getting into the industry, or already established persons in that in this industry, but they want to acquire a new skill or want to acquire something that they are not used to, they can learn from the journeys,
Right.
and at least that'll inspire them to take the first step. And as long as you take the first step, the rest follows.
That is true.
Right.
Yeah.
So I really appreciate you, Chet, coming to the show, helping me out and being my first guest. I can't thank you enough for helping me take my first step, and I hope I follow my own words and will follow the rest.
Awesome. I think it's gonna work out, Karma. I think like you said, your name speaks a lot, right? So and what I've known you so far, when I've known you over the years, Karma, I think you've always done righteous things. You've done things with your ethics, right? So I think whatever you do, you put all your heart in. So I think the next step, there's many more steps ahead. You're gonna go a long way.
Thank you. I appreciate the feedback, and push me to keep doing it, because sometimes we do get demotivated.
Yeah, that's true.
But if we have somebody that pushes us, it keeps us going. So I really appreciate you for being that person that always helps me no matter what. Right.
Same here.
Absolutely. Thank you so much,
Thank
Chet.
you so much, Karma.